Ever wonder what motivates people to get plastic surgery? Did they regret it? What can we learn from the stories of plastic surgery patients? I'm Dr. Javad Sajan, and this is the Plastic Surgeon Podcast. Welcome to our mini-sode called Clinic Talk. In the Clinic Talk episodes, Sabrina Sajan and I discuss unique and memorable events that happen at our plastic surgery practice. Sabrina, how's it going?
It's going great.
So at our practice, we have so many special events that happen, right?
Definitely.
And we can't talk about patient names or any unique identifying stuff, but we have some really unique stories, right?
Definitely.
And these stories are not just with patients, but also with the staff that we have the privilege of working with. Today, we're going to talk about three memorable events, if you will. So the first one has to do with bed bugs, right, Sabrina?
Yeah.
Now, this is something that's really unbelievable. So Sabrina and I come every morning to the clinic and the practice together, and we go home together, and it's really amazing. I feel really blessed. So we came on this surgery day to our surgery center, and I go in, and as I'm going into the practice, I'm in the elevator. My phone's blowing up, all these texts and calls, and I can't pick it up. It's in the elevator, and our anesthesia provider, Patrick, is blowing up my phone. And I'm trying to pick up the phone in the elevator, and it's just ringing like crazy, and I'm losing him in and out. So I walk in the door, and Patrick runs to me, right, Sabrina?
Yeah.
And he's like, Javad. I'm like, Patrick, what's going on, buddy? And Patrick is an amazing anesthesia provider, but sometimes he can get a little worked up, right?
Yeah.
And what did he tell me, Sabrina?
He's like, we have a situation, Javad.
So I'm like, okay, Patrick, let's go to my office. So we go and we sit down, and he's like, Javad, the patient has bed bugs. I'm like, Patrick, bro, what do you mean? He's like, there's sores and ulcers everywhere. There's bed bugs. We can't do the surgery. I'm like, Patrick, how do you know there's bed bugs? He's like, I saw sores. And then I asked him, so did you ask the patient? And he's like, yeah, they said they may have had bed bugs.
And then Angela walks in. Angela is one of our nurses here. And Angela runs to the office, and she says, well, first, they didn't tell us they had bed bugs. They said, I have an itching problem.
Yeah, Angela told us the patient said they scratched themselves, right?
Yes. They have a scratching problem.
Yes. And then what? And what did Angela say after that?
Angela said, are you sure you have a scratching problem? They said, yeah, this is normal. This happens all the time.
So I go in, and then so I have conflicting reports. I hear there's a scratching problem. I hear there's bed bugs. Everyone is freaked out, right? Because everyone knows bed bugs are not something you can easily get rid of if you have them. So I go in there to talk to the patient, and the patient has these little sores all over their legs and abdomen, and in the area I'm going to do the surgery. I'm not going to tell you guys which area. And so I ask him, what's going on? And first the patient tells me, well, doc, I like to pick at myself. And, some people are pickers. They pick at themselves. I'm like, okay, well, that's cool. But I'm like, how do you pick on the backside or your ankle? And they're like, well, I was at my friend's house, and they had some bed bugs, but I don't have any bed bugs. I had my house inspected by my doctor. So then I sit down. No, I didn't sit down because I was worried about bed bugs. So I stand in the corner of the room, and I nicely ask the patient, so you're telling me that the physician or doctor or provider you have went to your house to inspect the bugs? And they're like, no. They looked at me. I don't have any bed bugs, but my friend might have had bed bugs, but I don't have any bed bugs. I've been totally checked. Right, Sabrina?
Yeah. They denied everything, basically.
Yes. They totally denied everything. So then I said, we can't do the surgery at all, right?
Mm-hmm.
So I said, we're not doing the surgery. I'm sorry. I need certainty that you don't have bed bugs. And for many reasons, right, Sabrina?
Definitely.
Yeah. What are some of those reasons why we need to know?
Well, we need to know because it's, they're open wounds. And because we're doing a surgical procedure, we have to make sure that there's no open wounds or any infections going on before we start the surgery.
Exactly. And the other problem with that is if this patient really has bed bugs and we have them in our facility, that's like a huge risk, right?
Definitely.
So we canceled the surgery. So I told the patient, look, I'm sorry, we can't do the surgery. We got to cancel it. And then the patient, I'm like, our coordinator will be here to reschedule you and tell you what we need because we'll need a doctor's clearance. We'll need to make sure there's no bugs running around, right? And so I leave. And before the coordinator comes back, the patient opens the door, slams it shut, and runs out of the office.
Yeah.
It was unbelievable. So then we're trying to get a hold of the patient. No one's responding, right?
Yes.
And we're like, wow, this is so weird. And then we don't hear anything for a day or two. And then we get all these review notifications, right?
Yes.
So the patient wrote this long review of not pertinent to the bed bugs being super negative that we cancel the surgery.
Yes.
So obviously we called the patient, we finally got a hold of them, and we told them, this isn't fair. You're leaving us a review for canceling surgery because of bed bugs. And it was just a lot of back and forth, and we were happy to give the patient a refund. And we offered that to them, right?
Yes, definitely.
So after going, back and forth so many times, we're like, we're not doing. They were like, the patient demanded surgery, and I remember the patient said, and I even ended up talking to them, and they said, "Do my surgery. I don't want a refund, and if you don't do my surgery, I'm going to write more reviews."
Yeah.
And you know what I told them? Go ahead, because I can't jeopardize the safety of the practice, the safety of the patients, and now I have this combative situation that I don't want to deal with, right?
Mm-hmm.
So we ended up not doing the surgery. The patient left these ridiculously fake reviews, and eventually some time passed. They reached out back to us, and they said, okay, I'll take my money and remove the fake reviews because the reviews had nothing to do, zero, or why we canceled the surgery. So basically we gave them a refund, and then everybody walked away and it was over.
Yes.
Right. But this is like a bigger issue that we have in our clinic.
Oh, and then after that, when the patient runs out of the office, Patrick and Angela run and put on hazmat suits.
Oh my God, this was something, right? So basically the patient got us a letter that didn't have bed bugs, but we didn't know, we didn't trust them. So at the same time, when they left, right, we didn't know. So we had to shut that room down. The patient only sat in one chair in the exam room. And when Patrick and Angela put on this, like they look like those radiation people, right?
Yeah.
Right. And they went to Home Depot and we bought all that stuff. What was all that?
Yes, we bought a steamer, then we bought a humidifier, then we shampooed the entire carpet in that room and all the furniture. And it was a whole day worth of cleaning.
Exactly. And we couldn't use the room. We had to, we followed all the protocols for potential bed bug decontamination. It was this whole ordeal.
Yes.
It was something else.
So the entire surgery time was used up to be cleaning the room.
Exactly. And the real question that's asked, Sabrina, is something we deal with all the time, is when people intimidate us or threaten to leave fake reviews unless we mend to their will.
Mm-hmm.
And don't you think that's been happening a little bit more as we're getting more known?
Yes. And it's a little sad because a lot of times patients will start demanding things over the phone, like you must do my surgery or you must give me this price. I will not pay any more than this and so forth. But, we try our best to do whatever we can for the patient to make it work for them, such as this bed bug patient. When they called after a couple of days, they were cursing over the phone. They were that upset that we weren't doing their procedure.
So you deal with the patients more than I do as far as when they have certain issues or someone's not happy with either a med spa or a cream or anything like that. So how do you handle the patients that sometimes are saying, give me this or I'm going to give you a bad review? How do you manage those?
Well, we first, the main important part is to listen to these patients. We give them a call, we hear them out, and that's the most important thing. I think that's what a lot of patients are really looking for, is to see if someone's going to reach out. We always reach out to every patient. We always make sure everyone has a great experience at our practice. So we, call them, we hear them out. We want to understand what they're looking for. Then we give them an understanding of where we're coming from and why a price is the way it is, or why we can't proceed with surgery. And many times, most patients are able to understand where we're coming from, but there are those few outliers that don't understand that and end up, leaving negative or fake reviews.
And it's so wild because usually when someone leaves a bad review, they're not upset about that service.
Mm-hmm.
It's usually something else. And they're using that as a way of getting out their anger or whatever they're feeling. Don't you think so?
Yes. Mm-hmm.
That was a wild episode. And I'm really happy we stood our ground,
Mm-hmm.
There was a lot more interesting stuff that happened with that case, right? We can't talk about all of that.
Mm-hmm.
But let's talk about our next one.
Yes.
So what's the next one?
So the next one is, I guess, an ex-employee, or you can say one-day employee.
Oh, this was a wild episode. So the part of our practice that's been the hardest to recruit for and maintain is the role of insurance coordinator, right?
Yes.
This was absolutely wild. So we hired a person. We can't say their name, obviously.
Well, first they came in for their interview.
Okay.
Super sweet. We interviewed them. They were really, really nice. Super experienced. Had about 30 years of insurance experience. Knew all the words and knew exactly how to answer the questions. And as part of our interview process, for every position that we have here, we set up a job shadow day.
Yeah.
So we did the interview, went amazing. We set up a job shadow for this individual. They came in for the shadow.
And I remember that this person brought cookies.
Yes.
And I didn't use these words, but this person has so much experience. People were like, "Oh, wow, these are like my grandma's cookies." And this person reminds some of the other staff about their like grandma, and the patient liked that, right? She liked being called that.
Yes.
Yeah. So let's call the patient grandma because she liked that. I'm sorry, the staff member.
Yes. The staff member. Yeah. So she gave the grandma vibe to people. And she was really sweet and really very caring. And, she, after her shadow was completed, she hugged all the employees that she shadowed with. She, talked about how she can't wait to join our practice, and super, super sweet. Everyone loved her. And after usually when our shadow is done, we get feedback from everyone, and everyone had only positive things to say, right?
I remember that. And she had a cool story because she was a farmer, and then she had some issue on the farm she was living because her boyfriend kicked her out of the farm because he had somebody new. So then she was like, that was a little red flag, that whole story, that she was with her boyfriend on his farm. Then he was like, you can't be on my farm because I have this other girl on my farm. And so now you got to find your own place. And there was all this little drama thing going on, right? And that's why she was trying to work now.
Yes. And another funny part about our interview, I still remember till this day, is we always ask people, like, what are you looking for? What are you looking to make? You like to give a good get a good understanding of, you want to make sure that they're able to live on their own, and what we offer them is, good enough for them to be happy. And I remember she said, I want $7 an hour. That's what she said.
That was wild. Literally.
She literally said $7 an hour. And I said to her, that's not even the minimum wage. And she's like, yeah, I know that. She said, I just want $7 an hour because this is my passion. I love to do insurance work. I love to do the billing side of things. And that's enough for me to just, be happy and be on my own.
And we ended up making her an offer, and we couldn't pay her $7. So we paid her we offered her, right?
Yes.
A reasonable wage for that job. And she ended up taking it.
Yes. And then during her, we always ask a few preliminary questions during their interview. And they also have a little form that they have to fill out where, ask like, their past criminal history, ask if they had felonies. It asked if they've never arrested and things like that. And, everything was clear. Everything looked good.
Based on what she self-reported. And I even asked her during the interview. I asked everyone if you've ever been arrested or convicted of a crime. I remember she said no.
Correct. And all her forms, she said no. And everything looked great. We're like, oh, this is going to be an amazing hire. She's amazing. She has a lot of experience. The team was excited to have her. And then her first day. I still remember her background check was taking forever to come back. Do you remember that?
Oh, it usually comes back within a day, and we don't give people access to any patient data until their background check comes. So she was in the office. She started in the office.
Well, we also we pushed her start date out as well because her background check wasn't coming back. She had like loads of addresses on her background check information. So her background check wasn't coming back. So we pushed her start date out to make sure we would get it in time.
Yeah, and then we started her in the office because she said she wanted to work, and we just had her do paperwork. She didn't see any patient information, right? She was just like doing some admin stuff.
Yes, it was her first day, and I still remember I get a call. We were in the Seattle office, and I get a call from the Linwood office because this individual started at the Linwood office. And the call comes, and she was like, they were like, oh, this individual started their job today. And it was like probably the first hour or second hour of their position. And they're like, their background check came back. And I'm like, and what? And you remember what they said?
They said she's a pedophile.
Yes. And I was like, what do you mean? And they were like, she is a pedophile. And I was like, explain to me, what does a background check say? And they said that she's a sex offender.
That was crazy. I almost fell over when you told me that.
I was shocked out of my mind that this individual decided not to disclose this information and didn't think that we would find out.
I know, and I was really happy that we always take precautions, and she never had access to any patient data because we take care of children.
Correct.
We have pictures of children that have done surgeries on who are under 18. Obviously they're children, and I was like, oh my goodness.
So then I told the Linwood office, I said, take her into a room, make sure there's 2 people in the room, and then they called me and put me on speaker, and then
we called a lawyer.
Yes,
we called our medical law firm.
Yes, so on one line we called the medical law firm. On the other line, this individual with 2 other of our senior leads were in a room. And the medical law firm said that, unfortunately, we're unable to continue our employment with our office.
And we called the lawyer just to make sure we can legitimately fire her and not have an issue, because there's all these laws that you got to work around when you have employees, right? And we always want to follow the law. And the lawyers were like, totally fine, get rid of her ASAP.
Correct. It said you have to escort her right now. And just to get, an idea of what this individual was thinking, we asked her, we said, what's the story behind this? Can you tell us a little bit? And she says, many, many years ago, my partner was,
he had naked pictures of minors or something.
Yes. So she said that he was caught due to child pornography.
Yeah.
And she said she had nothing to do with it, and her partner had everything to do with it. And then I said, well, then why is it on your record? And she told us that, when it all went down and, we were they kind of found out that it was us, the police or the FBI, whoever the people are that come and get you. They basically told her that if she was to tell the police or the officials against that guy that she was with, they would let her go. And they would put the entire jail time on him. And she ended up doing that, which is why I think her partner got all the jail time and she was let go of it. But they said that she would still be registered as a sex offender.
And she had probation or something, right? That was unbelievable. How do you come to a medical practice, lie about your background, fill out a background check, lie on that, and then expect to get away with it?
Yeah. That's really sad.
It was so sad. It makes you really realize that sometimes, and I hate to say this, the people that you least expect to be people you can't trust are the ones that sometimes are the ones you trust. You end up trusting the least because of their actions.
I would have never imagined, never in a million years, that she would have been a sex offender.
Oh, that was so crazy. I'm just happy I didn't have any of Grandma's cookies. Right?
Me too.
Oh God, that was wild. And
she tried to hug me.
Remember one of our staff was pregnant at the time?
Yes.
And she was like, oh, I saw her looking at my baby.
She was like, I'm not walking her out. I need a chaperone. And 2 of our staff leads had to escort her out of the building.
Oh my God.
She only lasted 2 hours.
2 hours. I have a record for less. Oh God. I'm going to talk about that one today. So what's our next one? Our last one.
Our last one for today is going to be piercings.
Oh my goodness, guys. This is a public service announcement, okay? So before we do surgery, all of our patients meet with our nurse 3 weeks before and they go through the checklist, right, Sabrina?
Yes.
Now, what does the checklist say about piercings?
Remove all piercings before your surgery date.
And then they sign a form about that too, right?
Yes, they sign a consent that says, I have removed all of my piercings before my surgery date.
So we go to do surgery on this patient. They have a lot of piercings. They tell us they've taken everything out. Now when people have a lot of piercings, we're like extra cautious. We're like, are you sure everything is out? We 3 people ask them, the anesthesia provider, the nurse, and I do, and we all verified.
And can you tell everyone a little bit about why it's important to remove the piercings?
Oh yeah, absolutely. So when we do surgery, we use electrocautery in the surgery. Electrocautery, also known as what I call the fire stick.
Smoky stick.
Yes, a smoky stick. It's looks like a pen that you hold in your hand. It's hooked up to a wire to a base machine, and that emits heat in the form of electricity, and you use it to stop blood vessels and to cut tissue. So it's a really critical tool in surgery. Now, when you use that device, you have to have the patient grounded. We put a pad on their thigh, and that absorbs any of the current, right? Because the current goes through the body. So if you have metal anywhere in your body or piercings that are metal, they will attract electricity from the pen, and the patient will get a permanent burn, and that tissue will melt. There have been cases where people have lost their ears. They've had parts of their genitals deformed because they had genital piercings, nipples. So we are super careful because the last thing we want from an elective surgery is someone having a wild complication. And those burns are not repairable. Once tissue is dead, it's dead, and it gets replaced with really thick scar tissue, and it's disfiguring it. Horrendous. So we have this patient with a lot of piercings, pretty normal in Seattle. Everybody has piercings. So they take all their piercings off. They go to the OR. So in the OR, the patient is put to sleep like normal. And then when they're put to sleep, we have to put in a catheter for doing a long surgery or certain surgeries. So the urine can drain during the surgery in the catheter. So the nurse goes in and put the catheter, and she stops. And I'm in the room, getting ready for the surgery, going through the list with the other nurse. And she's like, "Doctor, I can't put the catheter." I'm like, "What do you mean you can't put the catheter?" She's like, "I can't put the catheter." And we're like, "What's going on?" And she said, the nurse told us there are piercings in the area of the vagina.
Oh my God.
So the patient didn't tell us, and they left piercings in their vagina. They had 3 piercings.
Wow.
And now we're in this conundrum of a situation, right? So what do we do with these piercings? We don't have consent to take them off. Do we just leave them and do the surgery? What do we do? So we had our anesthesia provider, Patrick, who's really familiar with piercings because he's seen so many of them. And they all were glass or plastic.
Oh, good.
So there were 3 piercings. So if they're glass or plastic, we still don't want them in the area just because it could cause pressure or other issues. So he looked at them. They were in a safe area, and we decided not to remove them because we didn't want to damage their tissue. None of us are experts in vaginal piercings. So we left the piercings there. There was no metal on them, thank God, or I would have had to cancel the surgery.
Wow.
And then we did the surgery, and things went great. There was no damage. But that could have been a near cancel. And it would have been a tremendous cost to everybody and risk had we not even looked and been thorough.
Yep. Because the patient was already asleep, so you couldn't even get the consent.
Yeah, that was something else. Piercings are dangerous, guys. No one wants you to remove them without a reason. The reason we remove them is purely for the safety of our patients.
Yep.
Sabrina, you help so many patients through the process of surgery. We can say without hesitation, thank God, you never had anything done, right? People ask that all the time.
Yes, I have not got anything done.
I'm just going to put it out there, okay? So people can stop asking. So in helping all these patients through their journeys, if you had to tell people one thing that would help them prepare for surgery or for their consultation, what would that be?
I think the most important thing I see throughout our practice and an advice that I would give to new patients that are coming for their consultation is to definitely do your homework and research so that you're able to ask the right questions at your consultation. I cannot tell you how many times we have patients come in for their consultation. They haven't done their homework. They're not prepared to ask the right questions with the doctor. And many times they will leave after the consultation and give us a call within the next day or week or, month and ask more questions. And that's perfectly fine. Everyone can ask as many questions as possible, but it's really important that when they're coming in for their consultation, they have the right questions that they can ask directly to the doctor. Because a lot of times if there's a patient that does give us a call back and has follow-up questions, what we do is we set up another consultation appointment or we set up a phone call. And a lot of times the doctor's schedule is really busy and they want their questions answered really quickly. And that might take a week or 2 weeks, might take a month to get them on the schedule. So it's really important that when they do come in for their consultation, just ask the right questions, do your homework, take your time, so that way you're prepared for your consultation.
That's great advice. One of the things I really believe in is you have to be comfortable, confident, and certain about your procedure and your doctor. And the only way you can do that is by doing what you just said. Sabrina, thank you so much for joining us. You all can find Sabrina on Instagram at Sabrina Sajan.
No, it's Mrs. Sajan.
Oh, yes, at Mrs. Sajan. Thanks for listening to the Plastic Surgeon Podcast. And tune in next week where I have an amazing patient who is a physician. She's going to talk about bot surgery that she had that I repaired. It's going to be a phenomenal story. Catch us on all social media at realdrseattle. And you can watch me on Snapchat at realdrseattle. Watch my surgeries live. Bam. What?